unanimous consent that the amendment be accepted as amended. And I
without
believe,
objection, that is the case, and the gentlelady has 5 minutes in support of her amendment.
I thank you. So let me do this for the members. My apologies to you. We have been engaged in legislative compromise, and I'm very delighted that that has happened. It is a sense of Congress that decades of experience and research have demonstrated that the opioid abuse epidemic and other, have demonstrated that a fiscally responsible approach to addressing the opioid abuse epidemic and other substance abuse epidemics requires treating such epidemics as a public health emergency, emphasizing prevention, treatment, and recovery. Let me thank my chairman and ranking member for working with me on this and ask my colleagues to support it. And that is, as I started out, I indicated that this is a significant moment in history. We want to move forward and to assure that, as many of my colleagues have said, that we have resources. But we also want to use this as a model. Many of you are need not to be reminded of the crack cocaine epidemic, which resulted in now almost 2 million people who are incarcerated in the nation's prisons, both local, state, and federal. And this point simply says we have found a model that deals with those who are addicted, who are not criminally involved, who are literally sick. And it is important to treat such epidemics, whether it's meth or other drugs, as public health emergencies, emphasizing prevention, treatment, and recovery. No matter where each conferee ends up on the final conference report, I think it's safe to say that the legislation we're considering holds a promise of saving and redeeming lives, tens of thousands. In many of our communities throughout America, we lost thousands of lives, families destroyed through the epidemic of crack cocaine, and certainly meth is another one. We know that our health professionals were overwhelmed. Our emergency centers were overwhelmed. In particular, those who were locked up, 80% of the defendants sentenced for crack offenses were African American, in spite of the fact that they were sick, addicted people with broken lives. I believe it is important, as we look forward to this conference, that we reflect what the American Public Health Association has indicated, that the ending of criminalization of drugs and drug consumers, prioritizing proven health treatment and harm reduction strategies, expanding and removing barriers to treatment and harm reduction services, including some innovative ways, is a way to address this sickness, this epidemic. And certainly, we have experienced that in many of our inner city communities. I can't tell you the funerals that I've gone to simply because people were addicted to crack, and I'm sure there are many other stories. I'm a member of the Opioid Heroin Caucus. I want to applaud them, and I want to applaud the conferees as well. The Jackson Lee Amendment is simply an explicit recognition and expression of the groundbreaking work done by this legislation and these conferees, and it shows that Congress listens to the American people, has courage to learn from the past, and is unafraid to embrace new, innovative, and promising methods of addressing the critical problem confronting our nation. Clearly, I want to commend the Chairman Upton and Goodlatte, Ranking Members Conyers and Pallone. I want to commend the Senate counterparts of Senator Leahy and Senator Grassley. And I simply want to say we buried too many people. We know what crack did. We know there are drug epidemics. We don't know what is next. My city just tried to do something about Kush users because of the drain on the public health system. We need to realize that we can deal with this in a way that is more than the way that we've looked at before. So I ask my colleagues to support the Jackson Lee Amendment. And I'm not sure, did the gentlelady want me to yield?
The gentlelady from New Hampshire.
Yeah, I yield to the gentlelady. I'm so sorry I didn't see you. Thank you.
Thank you very much, and thank you to Ms. Jackson Lee. I'm speaking on behalf as co-chair of the task force, bipartisan congressional task force to combat the heroin epidemic, and I just want to join your comments. I come from a rural state. This is a new phenomenon for us, but I commend your amendment. I urge a bipartisan support. We have now 85 members, bipartisan, in our task force because we recognize that this is a public health emergency. just very briefly, one county in my district, Sullivan County, they were able to implement treatment during incarceration, have
great.
a year-long program after, and brought the recidivism rate from the 80th percentile to the 20th percentile. I mean, that is something that everybody, RSNDs, can embrace. We can save tax dollars, and we can save people's lives. So I commend your amendment, and I urge a strong bipartisan vote.
I thank you. I yield back. I ask for support of the Jackson Lee amendment. Yield back.
Gentlelady yields back. Chair to recognize the gentleman from Virginia, Mr. Goodlatte.
Thank you, Mr. Chairman. I want to thank the gentlewoman from Texas for offering this sense of the Congress amendment, and I want to especially thank her for working with me and others on the committee to modify the language to make it bipartisan and acceptable to all, and I commend her for doing just that. So I urge my
If the
colleagues
gentleman
to
will
support the
yield.
amendment. I'd be happy to yield.
I also want to thank the gentlelady from Texas for sharing the amendment with us yesterday, and for working with the gentleman from Virginia to modify it. And it is certainly a very good piece, an amendment, and I support it as well. And yield back to the gentleman from Virginia, who yields back.
I yield back.
All those in favor of the time has expired. So all those in favor of the Jackson Lee amendment will vote. Say aye. Aye. Those opposed say no. Opinion chair. The ayes have it. The amendment is agreed to, and the amendment now, as modified, goes to the Senate. And the chair would recognize the gentleman from Iowa. Seeing none, the vote occurs on the amendment passed by the House conferees. Those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment is included, therefore, as part of the conference agreement.